Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about help. I got into the wrong medical billing and coding program. What do I do now? If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so I got an interesting exchange of a comment on a video I did literally titled Why I Recommend the CPC Study Guide for All Medical Coding Certification Exams. If you're asking me what book do I recommend and you comment on this video, I'm not going to answer. But this one I did answer because she didn't quite say what was going on. And so after a little digging, that's what inspired today's episode. So here we go. All right, so the comment reads, I am taking the AMCA Billing and Coding exam in May 2023. We're in March of 2023. And at that, we're already about in the middle of the month. So March 2023, and she's taking it in May 2023. She says, I have all of their study material, but I learn best doing videos. I don't know how you do videos, but okay. Please help, thank you. And I said, please help with what? Because she wasn't specific in what she needs help with. So she says, I'm just completely lost, LOL. Should I study with my material that they provided, or should I purchase any books to help? And I said, if you're taking it in May and we're already in March, there is no way you should feel this lost. The books I recommend in this video is what I recommend. You can study with whatever materials you like, but pick something and start. Don't overthink, just do. So then she comes back and she says, no one explained to me precisely what the differences were in the programs I chose from to take my certification. I'm just scared I might have chosen the wrong one because I can't find anything online to help me except their website. It's the AMCA, the American Medical Certification Association for Medical Coder and Biller Certification. I have never heard of this, guys, just so you know. And there's going to be a lot of off-brand places. This is why I always say, if you're going to sit for a certification, it has to be through the American Health Information Management Association or the American Academy of Professional Coders. And those links are always in the description box of all of my videos. And then so I replied, which she did not reply back. Okay, I'm just going to say that. So I said, employers look for AHIMA or AAPC credentials. I have no idea who the AMCA people are. Study with their materials, but look into AHIMA or AAPC credentials for certification. No one will explain things to you, especially for-profit schools, especially them. They are a business trying to sell a product. If you don't do your research, that's not on them. And that may be why she didn't respond to me. It may have hurt her feelings, but guys, we're all adults here, and let's be real. If you're not doing your research, guys, that's on you. No one is going to spoon feed you this information. You have to go out there and let your fingers do the walking, and you do your research. And this could easily be remedied by looking at the job listings, and you will see that no one is asking for this AMCA credential for probably MCBC, medical biller and coder. You know, no one's asking for that. They're all looking for the CCA, the CCS, the CCSP, or the CPC, or the RHIA or the RHIT. Those are all the ones that they look for. And so then I said, you didn't know, but it's okay. You're doing your research now. There's still time to correct this. Finish the program, pay attention to the books that I recommend in this video, get them, study with them, and when you certify, go with AHIMA or AAPC. And that's it. So here's the thing, guys. I will say this also. You cannot have a thin skin and get your feelings so hurt because of something that I say. And, oh, Blue, you were just so rude. How is it being rude when I'm being blunt? There's a difference between being rude and being blunt. I never say things in malice or where I'm trying to make somebody feel stupid. If you feel that way, that's really on you, because that's not where I'm trying to be. I'm trying to help you get to the right place. And if it's not what you're used to, and you're used to people telling you and holding your hand and being so sweet to you, I'm telling you now, when you get in the real world and you're out there applying for jobs, it's going to be a big shock when you're out there and you're just like, oh my gosh, I didn't expect this. This is the real world, guys. It's not all fun and games. It's not all, oh, I just think that I'm going to spend this, a few $1,000s and learn how to do medical billing and coding. And then all of a sudden I'm going to make all this thousands of dollars when I get out in the real world. It's very upsetting that there's schools like this and that people get sucked into these things. But these are salespeople. And I am not a salesperson. What I am is a devout medical coder who is willing to share what I know. And so when I tell you guys, look through my videos, they're all there. And I try to be as specific with the titles as possible on what to do on, if you find yourself in a program where you're not learning, how do you remedy that? Use the independent study list. The independent study list, or the syllabus rather, is a list of all the books that I recommend. And you don't have to go through a formal program to learn medical billing and coding. And in order to sit for AHIIM or AAPC credentials, you do not have to go through a formal program. All you have to do is know the material, and then you pick whatever certification you want to. For medical coding, it's the CCS, that is the gold standard of medical coding credentials. The CCA, the Certified Coding Associate, that is the entry-level medical coding certification. This is a very viable credential. It says that you have the entry-level knowledge to code not just outpatient, but inpatient as well. The CCS is the mastery, just so you guys know. And do I recommend it for new people right out of the gate? Probably not, because a lot of you are not getting the education that you should in order to be able to sit for the certification and successfully pass it on the first try. Okay, and then the other one is the CCSP, the Certified Coding Specialist, physician-based. And that is all outpatient coding, and that is the American Health Information Management Association's outpatient mastery credential. So if you went through a program and they only taught you outpatient coding, which is just with the CPT manual, the ICD-10-CM manual, and the HCPCS manual, then that's the certification that you want to sit for. The CCS and the CCA both require you to know about inpatient and outpatient coding. So you have to know the ICD-10 PCS as well, and that's a completely different animal. But if you know that ICD-10-CM, the diagnosis coding, the CPT, which is the procedure coding, and the HCPCS level 2, then you're okay to take that CCSP, okay? And then, of course, AAPC has their CPC, their flagship credential. Now, keep in mind this, all right? AHIIM is a non-profit organization. They do not require their members to be members every single year in order to maintain their credentials, and they have a different fee structure, okay? If you don't get your membership, they'll just charge you separately to report your CEUs. And the CEUs, or continuing education units, are reported every 2 years, and it's reasonable. It's 20 CEUs for one certification. If you are with AAPC, the American Academy of Professional Coders, this is a for-profit organization. They are about the sale. They are about sell, sell, sell. So they have their flagship credential, which is the CPC, or the Certified Professional Coder. If you get this credential and you have no prior experience in medical coding, it will have a -A attached to it, which is for apprentice. Now, this is a 2-year time commitment. There is a way to hurry up and remove it, which is by going through their program for medical billing and coding, or you can, and that'll take 1 year off. If you do Practicode, that'll take the other year off. So when you complete your exam, you will be a full-fledged CPC instead of a CPCA. The only problem with this is, even though you have a CPC and not a CPCA, you still have no experience. So if you have no experience, I'm just saying, guys, I don't know why people feel the need to hurry up and rush to pay to get all of these things taken off when you have just as much chance as a CPCA to get in, okay? So if they're telling you, oh, no one wants to hire CPCAs, that's wrong. Yes, they do. I write resumes all the time, and I've written them for CPCAs, and they get jobs. I'm just saying. But guys, just so you know, another little footnote, my calendar is completely booked for the month of March. I have no more slots available right now. So I will be available in April, and I will make an announcement about that date because I need to look at the calendar again, because April's already starting to book up too. So, but I will leave that somewhere in the community tab. But just know for right now, I do not have any spots available. So continuing on, guys, the best way to remedy this, if you get into one of these fast-paced medical coding schools like this program, which I have no idea who these people are, it's the first time I've heard of them. If you get into this program, get the material, study with the material, because you're learning the same thing. What this person is doing, I think, is looking for specifically materials that have the, what is it? I don't even remember the name of it now. The American Medical Certification Association. She's looking specifically for those things. That's what I'm thinking. And you're not going to find any because it's on their website. So, but if you know that you're looking for the fundamentals of, you're looking for ICD-10-CM, CPT, HCPCS, you're looking for medical terminology, anatomy, pathophysiology, medical law and ethics. Those are the things that are universal to any medical coding certification. Okay, so that's just what I'm going to be putting out there. So again, if you look at the independent study list, because the link is always in the description box below, always, okay? Get that, study with that, and if you feel like the program is too fast because it was either a 2-month program or a 4-month program, which I tell y'all not to do, because that's just too much. It's too much. And it doesn't matter how smart you are. It doesn't matter if you've been a nurse before. It does not matter. Medical coding takes time to learn. And if you say, well, no, I got through it. Okay, that's fine. But let's see you in the real world. Let's see how you do in the real world and see how fast you can catch on in the real world too. I'm just saying, okay? So do that, study with those books that I recommend. I recommend the ICD-10-CM and ICD-10-PCS Coding Handbook with the answers. You can get the 2021 version, the 2022 version, and it's by the American Hospital Association. Nellie Leon Chizen is the one who wrote that book. And even if you are not studying for the PCS side, like your exam is just outpatient, you can skip that part. But it does teach you about diagnosis coding, which a lot of people struggle with, is that diagnosis coding, because it's like, oh, Blue, the book is so big and it's just so much. Guys, this is what you signed up for. This is what you are going to be working with forever for your entire career. So you got to stop complaining about the size of these books, because yeah, they are big and they're going to get bigger every year because these codes get updated. Sometimes they get deleted. It really all depends, but the code set is always going to expand. It's designed to expand, which means it's going to have more and more added to it as, you know, new technology comes out, or as new disease processes get discovered. It's just like when COVID hit and they had to make that emergency new code for COVID in 2020, which was unprecedented at the time. So that's something else that you have to realize, guys. We have to always be prepared for change, okay? So get with those books and study with those books. I'm going to be doing a video this week talking about study schedules and why it's important to go with the 20 hours per week. And I know a lot of you are hearing me because I get the emails and I get the comments, and then I get the long line of excuses on why you just cannot do 20 hours. You don't have to justify it to me, guys. You don't have to justify it to me at all. It's you that wants to be the medical coder. I'm already a medical coder. I already have my career. You're the one who wants to get into this career field. So in order to be successful in this career field, that's something that you have to be able to put in there, the time. Because no amount of money will get you to pass these exams. No amount of money will get you to understand the material so that you can be a high caliber medical coder. No amount of money. That takes personal effort to get into and personal effort to get right. So that's just what I'm saying there, guys. You know, like I said, I don't want you guys to think, oh, you're just being mean. It's not about being mean, guys. And if you really truly understood where I was coming from, if you've taken any amount of time to watch my videos, you'd know that. You would know that when it comes to this field, I'm very serious about it. I want people to be set up for success. I don't want them to have to depend on circling or highlighting or any of those things, or tabbing the books, because if that's what you're doing, that tells me that you're not using your books enough. You have to practice with these books. And there's no other, well, how do I do this? How do I do this? You sit in front of that book and you work with that book. Work with the workbooks until you understand it. That CPC study guide, the one that I talk about in that video, it's excellent. I mean, I'll give it to AAPC there. They did a fantastic job with that book. And it's easy for new medical coders to understand. I've talked about the Bucks book in the past, where I don't recommend Bucks books. I will never recommend Bucks books, because Bucks books are not written in a way for new medical coders to understand as easily, in my opinion. So, that's just what I would say. But if you find yourself in one of these programs where it's just some off-the-wall, off-brand type credential that they're having you sit for, get all the material you can and study on your own until you feel confident enough to take one of the medical coding certifications, the CCA, CCS, CCSP, or the CPC. Okay? If you're brand new and you've only learned outpatient, I recommend you look at the CPC or the CCSP. Okay? The Certified Coding Specialist Physician based with AHIIM. Now, people will tell me, oh no, they ask for experience. I don't know why people always miss that one word, that one key word. While it's not required, it is recommended. They always miss that word. Always, always, always. So don't miss that, guys. You can take that exam if you have studied on your own and you're prepared. You can certainly take that exam. Okay, so you only need one. You don't need to be certified through both. You're not going to get extra brownie points when you're out there in the real world just because you have two credentials that say the same thing, right? If you get the CCSP and then you say, oh, I want to sit for the CPC as well, they're not going to give you brownie points for that. And all you're doing is making yourself pay more money, because AAPC requires you to be a member. Every single year you have your certification. So you will have to pay $205 every single year. If you do not, they will take your credential away. And they won't hesitate, guys, because again, it's a business. So with that said, I'm going to go ahead and wrap this one up. But guys, again, don't be sensitive about the things that I tell y'all. I'm telling y'all for your own good, okay? That's really all I'm telling you for. And I don't want anybody to take what I say the wrong way. There's nothing I can do if you take it the wrong way. But what I'm here to do is to help you all. And I'm here to lead you the right way. If you don't know where to go and you still feel lost, find yourself a mentor or find a tutor. Okay, there's a ton of tutors on LinkedIn. All you have to do is just say, hey, I'm looking for a tutor for medical coding, and you'll get people either telling you that they tutor, or you're gonna get a bunch of recommendations. Okay, so again, my calendar is closed until April. All right, so with that said, I'm gonna go ahead and wrap this one up. Best of luck to you guys out there. You can do it. You just have to put in the time to study, and you will get there. All right, so if this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.